Datapalooza community, and the selection of the winner is made by an expert committee on the basis of professional contributions toward and impact on the open health data movement. Now it is my enormous pleasure to introduce to you the fourth winner of the annual Health Data Liberator Award, Fred Trotter. So I'm going to present Fred hails from Houston, Texas. He has a BS in computer science, a BA in psychology, and a BA in philosophy from Trinity University. He is a computer scientist, philosopher, psychologist, which is a fantastic background to have if you're a Health Data Liberator. He's the founder of the data journalism group .craft Journal and of CareSet Systems, a healthcare technology startup offering network and referral optimization. He, as I think everyone knows, also co-wrote Hacking Healthcare and is deeply involved in the e-patient movement, the quantified self movement, and the open source health informatics community. His best-known technology contributions include building tools to help empower patients to improve their own care and health. Over the last several years, he has been among the most innovative champions in utilizing Medicare data to power improvements in the transparency of healthcare cost and quality. You'll hear from today, actually, on new innovation. He is bringing forward yet again to help consumers understand the referral relationships among physicians and healthcare institutions and the impact these have on patient outcomes. To know Fred is to love him, desperately. He's been an avid force for change in healthcare for many years. He's a key pillar of our Datapalooza community. I can't think of literally anyone who deserves this recognition more. In the name of Health Data Liberator, please join me in congratulating the amazing Fred Trotter, the winner of the 4th annual Health Data Liberator Award.
Thank you. I'm going to put this down because I would be the person to drop this and have the first time that would ever have happened here. So Todd Park years ago encouraged me to make my first FOIA request. So thank you. When you are a figurehead or a spokesmodel like myself, you have to admit when other people are pulling on the same oars. And I would like to thank Ashish Patel, Rick and Alma Trotter, Laura Chaplin, who make the team that I work with. That team would have never had the resources or access or insights that we would have needed to release the data we have without other organizations, specifically Merck, Athena Health, ONC, Academy Health, Robert Wood Johnson Foundation, O'Reilly Media, PCOR, CMS, and HHS, all organizations who have specifically made bets on our team that have gotten us to the place we are today. I don't have time to thank all of the individuals who have helped, but I would like to make one exception to that, and that is for Aman Bandari, who slowly... I think he's in the audience, but he is the person who convinced me that this should not be a hobby, but instead be a profession, and I feel like that's significant. There are basically two perspectives on data. Either one perspective says that data is a resource like coal or diamonds or oil. Access to it should be protected, and owners should seek to maximize their profits from these resources. The other perspective is that patient data is like water or air, and that we all own it and deserve access to it. Under the first perspective, patient data is something to be hoarded. Under the second, it is supposed to be protected so that it can be shared safely. Under one model, it is critical to ensure that the data is in the hands of those who can make the most money from it. And in the other, it is critical that data be in the hands who can do the best science on it. Under the first model, profit comes on the front side by providing access to silos of patient data. Under the second model, profit comes when you solve a specific problem for a patient or a doctor. People in the first camp call those of us in the second camp things like data parasites. And we have names for them too, but I had to make a promise not to say those things in this speech. This decade will be the last decade in which man is the only intelligent species on this planet. No child born today will ever know a time when there was something they could do intellectually which could not be also done by artificial intelligence. It is a mistake to think of artificial intelligence as merely software, algorithms, and hardware. It is also data. That means that it's really not a debate about access to data. It is a debate about the access to the application of intellect. It is a debate about whether healthcare intellect will serve patients or profit. The policies we choose today about access to data and how artificial intelligence will interact with them will determine and influence how computers are interacting with humans for the next 1,000 years. So the stakes are pretty high. Which is why I have to be constantly apologize for being too overzealous about this. The worst part about my habit is that I'm constantly harassing those who are doing the most good. I know for a fact that employees at HHS and CMS are exhausted by me. In fact, as soon as they heard that I might be getting this award, several of my government friends called me to warn me that this was not an opportunity for me to rant about all the things that I wanted HHS or CMS to do differently. It is in this conversation that I gathered some of my best word and phrasing choices would be off limits for this particular talk. You see, I have a habit of ranting to the choir, and this speech is already an example of that. Here I am lecturing a bunch of people who are giving me an award for liberating data on how important it is to liberate data. We need to convince everybody else. We need to convince every hospital, practice, care, pharmacy, state, local, and foreign governments that they should be implementing the same standards for openness that are now standard at HHS and NHS. But that is tomorrow's fight. In order to win that fight, we need to establish one principle beyond any doubt. Healthcare data is more valuable to society in the open. There are two things that we are going to be doing to make that point. First, CareSet Systems, our analytics company, will become the first data science as a service company that is powered by Medicare data. CareSet will make money not by hoarding access to data, but by using data to solve hard problems in healthcare. The second is to ensure that CareSet is not the only company that can rely on DocGraph for data. To that end, we are happy to announce the release of a new DocGraph data set. This is what we call Mr. Pup. I'm not in charge of naming, I should point out, at my organization, which is very much like the data set that Nile releases, but instead of showing how outpatient doctors perform procedures, it shows how they refer procedures. Academy Health will set up a demonstration in the press room after this session. If anyone is interested in learning more about what are in the data sets, and if you can prove that you were here on Twitter, we'll give you a free copy of the open source version. I would like to thank the Datapalooza community for giving this award. It is easily the coolest thing I have ever done in my career, and I really appreciate it. You can find me later on if you would like to talk with this trophy in this hotel bar, which is the only place where women might find me carrying that around more attractive.
Tall people, sometimes a challenge.